Well, there's several different types of weight loss surgery that are performed commonly today. The lap band surgery is a very, very safe surgery. That's why it's become so popular. The procedure essentially involves placing a simple inflatable balloon around the top of the stomach. It takes less than an hour. It's an outpatient procedure. The complication rate is very, very low with regards to the procedure, and the weight loss is very, very good. The gastric bypass, that's a little bit more complicated than a lap band. Usually takes 2 hours. The hospital stay is 3 to 4 days. It involves actually disconnecting the stomach from the intestines and making a small little pouch, and your food enters that small little pouch, bypasses a part of your intestines, and then passes through the rest of the way in a normal manner. The gastric bypass is a very, very effective way for losing weight. The third commonly done procedure now is called a gastric sleeve. That's relatively new. We don't really know the very long-term results of it, but the early results are very, very outstanding. And that simply involves removing a segment of the stomach without re-rooting the intestines. Again, it's done laparoscopically, which means minimally invasively through small little incisions. Usually it's an overnight stay in the hospital, and most people are home the next day.
We see weight loss surgery as a very safe procedure. We feel that the risk of having a complication is significantly less than having a complication related to obesity in the long term.
There are risks associated with all forms of surgery, just as there's a risk to driving down the freeway. The risks are small, and over the years, the complication rates have come down with improved techniques.
It's still trying to overcome the bad reputation that it had 15 or 20 years ago when the procedure was first being done, when learning curves were happening between the surgeons and the procedures. It has been compared with other very commonly done procedures, and the complication and the mortality rate are much lower than a lot of the procedures that are daily performed.